clock is running.
The behemoth can't sleep. Her and her babies, this is high risk. Babies could literally die.
5 expectant mothers.
Basically, anything that can go wrong has gone wrong.
8 babies who just won't wait.
Probably gonna have 1 or 2 pushes ahead is right here.
She's had 1 prior cesarean, so that also puts her at risk with this pregnancy.
There's no time to waste.
There's still a good chance that the baby isn't going to survive.
When special deliveries take place around the clock. It's noon at Medical City Center in Dallas, Texas.
Baby C's head's over here.
Alejandra Muchnick, better known as Alex, is about to see her babies, all 3 of them.
This is baby A here. Best place to get baby B here would be about right there.
One of Alex's triplets, baby B, also has a serious condition called an omphalocele.
Baby B's heart is right there beating, and then that's the omphalocele. What I found was that in twin B there was an omphalocele, which means the abdominal wall did not close properly. So you end up having, in this particular case, the liver is outside of the abdomen, as is some of the bowel. And that puts the pregnancy at a greater risk for stillbirth. So this is actually partially liver in here. And this is
If the baby survives, a small omphalocele could be repaired by pushing it back into the abdomen.
And if you have a lot of organ outside of the abdomen, then it becomes more difficult. They may have to resort to surgery. And in a premature infant, that puts the baby at more risk.
My babies, that's my biggest worry, that we have high hopes that everything will go smoothly, she'll have the surgeries and everything will be fine.
Alex was having trouble conceiving, but after treatment with a fertility drug, Clomid, she was told she was not only pregnant, but carrying triplets.
It was just at that point, it was just shocking. You know, 3 babies at once. But everything looked good, and from then on, everything's been going pretty good until this hospitalization.
And so this is just like the baby's blood pressure.
Alex was admitted because of the multitude of problems the triplets face. She has a biophysical profile done 3 times a week, so doctors can carefully monitor baby B's health.
That's a little bit of ascites, or the fluid around baby B's bowel. So that white part is the bowel.
If baby B dies in utero, the other 2 infants may not make it either.
I'm not too optimistic for baby B, but I'm hopeful.
We always thought it was going to be a smooth pregnancy.
We always hoped.
We always, hoped that it was just going to be a smooth pregnancy.
Yeah.
No, we had no idea we were going to have to do so many visits or learn so much about things that we had no idea about.
We always thought it was basically you get pregnant, it's smooth sailing, and there's the babies. You take them home and live happily ever after. But it's not quite that. It's not quite that easy.
It's 10 at night when Debbie Burris is wheeled into a labor and delivery room. She is carrying twins and is having strong contractions.
Here we are.
But if she delivers tonight, her babies will come 2 months early. Debbie's been restricted to bed rest in Medical City Center for 2 weeks and has already survived 1 crisis.
We did have the scare, that I call it, where we came in with the contractions, and we were actually going into preterm labor at that point. And
This is the girl?
this is the girl. She's going to be right in here.
See how good you are.
Left a little bit more.
If the twins are born now, their lungs may not be developed enough to keep them alive.
For her and her babies, this is high risk. Again, we've seen worse, obviously. The babies could literally die. I mean, that's not, I don't even want to think about it. I mean, that could happen. That's possible. How are you? You're trying to hang on?
Yeah.
I think this may be the real deal.
I know it won't be long if it's not the real deal.
To stop her premature contractions, Debbie has been given Demerol, a potent narcotic. The drug is used cautiously because it can depress a baby's ability to breathe upon delivery.
This is our third time in labor and delivery in the last 2 weeks. So we never know if it's going to be the real thing or not. So.
Okay, it looks like the contractions have. Oh, well, we don't know if it's a false alarm. You had some contractions, so it's not a false alarm. Looks like what we've done may have had some effect on the contractions. So if we've been able to abate the contractions, all well and good. We'll gain some more time. So every day is obviously critical in terms of your babies. All righty, so we'll just do some watchful waiting.
Okay.
And if we have contractions, lots of them, we'll check the cervix and see if the cervix is starting to dilate. And if that is indeed so, we're going to have some babies.
John thinks the time has come.
I just made a phone call to my mother-in-law and father-in-law. I told them it's about to happen. We've been here before, but like I said earlier, it feels different.
But Dr. Parnell is cautious.
I don't want to check the cervix unless I can demonstrate that she's having irregular, predictable type contractions.
It's been 8 minutes since she had a contraction.
That's good news.
He hopes to postpone delivery any way he can.
Again, the most important thing is to try to keep the babies exactly where they are. That's obviously the best incubator that there is what Mom has. We can do a good job in our nursery, but again, that's the best incubator at the moment. Well, it looks like they're about 8 minutes apart or more. And I think that we're not going to be able to make it through tonight.
Approaching midnight, it looks like the babies will wait another day.
Yeah, any questions?
Just wait and see.
That's right. What's the waiting see game? Okay, super.
Yeah. It's been up and down tonight, man, I tell you.
John's parents have been called off.
I think we just had another false alarm, I think. So I'm starting to get used to it now.
I still think that they're going, they're coming, but just not tonight.
You're going to be in LDR 7. So let me hold this before you sit down.
Misty Ferguson is nearly full term in her first pregnancy. She came in having contractions and a series of problems.
Here we go.
Basically, anything that can go wrong has gone wrong. I just don't want to hear no women scream.
You won't. The walls are really tight.
Good.
Yeah.
Misty has PIH, pregnancy-induced hypertension. Along with her high blood pressure, she has swelling and a high level of protein in her urine, all symptoms of preeclampsia. It is a dangerous condition that can lead to convulsions. The only real cure for preeclampsia is the birth of the baby.
The blood pressure tends not to cause as much a problem for the baby as it does for the mother. Now that is not 100% true, but when it develops later in pregnancy, really the mother is at more jeopardy than the baby is. Let your legs fall all the way apart for me.
Misty's blood pressure is getting dangerously high. Dr. Milstein is worried that she could go into convulsions. He's decided to induce labor. To help her labor, he inserts a cervix softener.
And that's it, kiddo. We'll probably get started somewhere around 7 o'clock tomorrow morning.
If her labor doesn't progress, she might need an emergency C-section.
You shouldn't really feel this.
Erica Sanders is 21 years old and a mother of 2.
Now I'm nervous about everything. But you've done this before, right? Does that scare you?
Yes.
It scares you? She's a high risk for a premature labor and delivery because she's done it before.
Erica wants to deliver vaginally, but a previous C-section leaves her susceptible to a serious complication.
Well, worst case scenario would be if her uterus were to rupture or open up, a uterine rupture from the prior incision, from the prior cesarean section.
To make matters worse, Erica is 10 weeks early, and today she started contractions.
Let me check her. Let's see where she is. If she's further, I'm gonna go ahead and just break her.
Baby born at 30 weeks gestation faces risk with lungs being immature. They face a risk with cerebral palsy, if there's an infection or anything that's causing her to have preterm labor and preterm delivery.
An infection might be the cause of her early labor, so Erica is also given antibiotics.
Erica, I'm going to go ahead and hang some antibiotics.
All right, you may not even feel this, okay, from your epidural. Oh, yeah, she still got some cervix there when I rubbed it, but it's just
Dr.
bad.
Butler waits to break her water so the antibiotics have a chance to work. She wants to give Erica's premature baby the best chance at survival.
What's next for Erica? I'm looking for her to deliver within the next hour or so.
For Erica, the dangers are real, and the threats remain around the clock. It's 1 a.m., and John Burris is waking up his family.
Dr. Parnell said they're gonna take the babies tonight.
Squeeze the pillow you can, but you have to put your hips wider.
In a surprising U-turn, Debbie's false alarm has become a race to the operating room. Her doctor has suddenly ordered a C-section to deliver her twins.
She started having contractions, and we're going to be having some babies.
Okay, I want you to relax your shoulders, put your chin to your chest.
I think the dilatation of the cervix was most important, rather than the number of contractions. The cervix dilating will obviously demonstrate that she's in labor.
Take nice slow deep breaths, relax your shoulders.
Yep, it's strong, it's strong, it's strong.
Her epidural is started at 1:20 in the morning.
This time, the contractions really weren't stopping. They did slow down, and so we were hoping that it was another false alarm, but it wasn't.
Okay, we're all done.
And he came in with his scrubs on, and I knew that we're actually going to do it this time.
Debbie is upset. She knows her babies will be delivered 8 weeks early.
Yes, it was scary. First, I had to get over the shock of this is the real thing. I was excited, but nervous at the same time. Just a little anxious about the whole process.
It's nearing 2 a.m. as the C-section gets underway.
I do remember Dr. Parmel asking, Debbie, Ms. Burris, are you ready? Are you ready? Because we're getting ready to do this.
2 teams from the NICU stand by.
We're going to separate the fascia and the muscle away from each other here. Pair of nails, please. A couple of hemostats, please. Metronome scissors, please. Slowly. All righty, we have a little boy here.
John Burris III arrives at 2:04 a.m.
Okay, we got one reach. Little girl is reach. Systematically here. Wonderful.
That's right, hemostats and that's fine.
Okay, here we go.
Moments later, Journey Burris is placed in the hands of the NICU team.
Man, oh, to explain.
There should be another one on there, Dad.
Baby John is in some trouble. He suffers apnea. The baby is forgetting to breathe.
That's doing all right now, Dad. We may need to put him on some support for breathing downstairs.
Okay.
Miss Burris, here you go, real quick, okay? Little girl, this is the little boy, all right?
He's sweet.
We're going to take him downstairs and get him settled in, okay?
Both infants are in danger because of the early delivery. They need more help and are rushed to the NICU. Baby Journey weighs 3 pounds 5 ounces. John, a bit less, 3 pounds 2 ounces. Their lungs need help staying inflated.
What this will do is it'll help keep her lungs open. Yeah. Okay, so that she'll be able to oxygenate just a little bit better. Okay. Because she's having a little trouble doing that right now.
Okay. It's like the lungs are like a balloon. When it collapses, they stick together. And with the CPAP, that keeps it open a little bit. And what's happening when we have to intubate him is the CPAP's just not helping open him.
By 3 a.m., the twins seem stable. But with premature babies, the first few days are always touch and go.
All preemies are in danger. I mean, in every delivery, there's always a chance. And that's why we tell the parents it's very up and down.
Just hours old, they must fight for their lives, around the clock. It's 1 p.m. on Erica Sanders' 17th day under observation in the hospital. Dr. Butler rushes back to Erica's room because Erica's unborn baby could be in danger.
Yeah, she's had a decel there. I want to see what's going on. Decel is looking at the fetal heart rate on the monitor, and when the baby's heartbeat goes down beneath what we consider to be that baby's baseline. And so with her being premature and her cervix is dilated, I'm kind of worried that she's probably dilated even further. And there's compression on the cord there, on the baby's umbilical cord, that's causing that drop in the heart rate like that. When I check you this time, I'm going to go ahead and break your bag of water, okay?
The cord compressions are a troubling new development. The delivery of Erica's baby can be delayed no longer.
Okay, you got to open your legs for me. There you go. Okay, clear fluid.
Give me some more medicine. You break it?
Uh-huh. She's 7.
As delivery approaches, the baby's heart rate continues to dip. Erica is given oxygen.
When she's on oxygen, the baby's heart tones she's having some more what we call variables, dips in the heartbeat, and that's just based upon cord compression. The cord is being compressed. It's just as if you were holding your breath. So we're giving the mom some oxygen just to help with the oxygen, giving oxygen to the baby, to help the baby.
An internal monitor will record her contractions. The stronger they get, the more they choke off the baby's oxygen.
This internal monitor tells us how strong the contractions are.
For now, they can only watch and hope that a C-section won't be required. Jenna Barch was just admitted to Medical City Center. Her doctor has started her on Pitocin to induce labor. 3 weeks before her due date, her baby is already more than 7 pounds. And if she waits...
Yeah, she could have been 10 to 11 pounds, easy.
A size that could seriously complicate delivery.
We came in early to make sure that the baby didn't get too big and make sure I made it to the hospital in time.
Hate to get stuck out on the highway with a pregnant woman in labor.
Jana has had an epidural, so she feels no pain.
I feel kind of tingly. My toes are a little tingly.
It's just after 10 a.m. when her water is broken, and her doctor inserts a monitor to measure the intensity of her contractions.
And then just basically I just put this into the uterine cavity, and as the uterus squeezes on the baby, it squeezes on the monitor. That's it.
Jana and her doctor are relaxed, but the risks that come with delivering a large baby are very serious.
If you deliver a big baby vaginally, there's always a chance of shoulder dystocia happening, which can be very dangerous for the baby.
Shoulder dystocia occurs when the baby's shoulder gets stuck in the birth canal. It can result in permanent nerve damage to the baby's shoulder and arm.
That's probably the most scary of all the various things because it's not predictable. I mean, they classically have no anticipatory signs. They go through normal labor, and it's not until the head's out that you make the diagnosis. So, you know, that's a scary one.
The situation can cause an irreparable nerve injury.
It can be so severe that maybe the baby that's born with that may not be able to ever use that arm. That should be strong enough to dilate.
Nearly 3 hours into labor.
How you feeling?
I'm gonna lay your head back.
Contraction pattern looks fantastic.
Jana appears to be right on schedule.
I'd say she's 4 to 5.
Okay.
But looks can be deceiving, and Jana's delivery is about to take an unexpected twist.
Have your hair.
Alex Muchnick is in her 29th week carrying triplets.
Does this have fuzz like here?
I was floored. I was shocked. I was happy. I was concerned. Our family of 2 is going to be a family of 5.
Alex is in a holding pattern. Doctors want to wait until her 32nd week before delivering the babies. But baby B has a hole in its abdomen, a condition called an omphalocele.
It's scary. I mean, it's very scary because the odds of having a baby with an omphalocele are so remote. It's 1 in 4 to 5,000. But we've also been told that even if there is no change and the baby's born, that there's still a good chance that the baby isn't going to survive after birth. But you got to keep hope.
I think we've heard all 3, and we're very happy.
While fearing the worst, the couple makes plans for the best. Dr. Jay Roden, a pediatric surgeon, is brought on board to repair the defect once the baby is born.
Knock, knock. We'll check on the size of the omphalocele. They'll recheck the heart, ultrasound, look at the kidneys, and just generally look at the child and make sure there's okay and the lungs are okay and get things stabilized. They'll start some kind of an IV so they can give IV fluids. And then we'll kind of assess things as to where to go from there.
And at that time, then you'll have an idea of how long it's going to take to put everything back inside and close
Right, can at least form a game plan at that point about the prolonged delayed closure versus the sooner closure, and the 2 varieties of that. If we think we can get the abdominal wall closed, this hospitalization before the baby goes home, sometimes you can close it all in one operation at the initial operation.
But no one can predict what will happen until Alex's triplets are born. With high blood pressure threatening her health, Misty Ferguson has had a difficult night. She woke up in pain every hour. Then her water was broken at 7:30 this morning, and Pitocin was started to induce contractions.
How far are they apart now?
2 to 3.
Overnight, she dilated to 3 centimeters, but then went back down to 1, a situation her doctor finds odd.
The worst scenario is that the blood pressure process continues. It can cause Misty to have swelling of her brain and lead to a seizure.
A seizure now would cut off the supply of nourishing blood to her baby. To minimize the risk, Misty is given magnesium sulfate to prevent seizures. The good news is that her blood pressure is down. The bad news is that Misty is in pain. She says it's a 10 on a scale of 10.
I'm scared. It hurts.
An epidural catheter has already been inserted, but the medication cannot be given until she is closer to delivery. Misty's mother, Barbie, has doubts.
Does he feel comfortable with it like this? Because it is scaring me. And if it's going to continue to do that, what are the reasons for not going ahead and do a cesarean?
Go ahead and push for me. Push.
You want
Come on,
the
okay, stop pushing.
10 weeks before her due date, Erica Sanders is about to deliver. Despite a previous C-section, this time she is going to try to deliver vaginally.
We're going to go ahead and get set up for the delivery now. She's going to have probably a couple of pushes and we'll be delivering.
Your body's pulling.
Yeah. Can you grab my
So you're probably going to have 1 or 2 pushes. The head is right here. The NICU is on their way, right? Yeah. Okay. Can you go ahead and push down for me?
And I see this cover.
Good push, 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 push. Well, all right, stop pushing. Stop pushing. Not really. Go ahead and push.
Ooh, here we come, here we come. Little girl.
That's Erica. Congratulations.
Erica's baby girl is quickly handed over to the team from the NICU. At first, the baby needs help breathing.
There you go. When the baby came out, the baby had a what we call a body cord. The cord was wrapped around the body, and with each contraction, it was pressing on that cord as if the baby was holding his breath.
Without critical help, Erica's daughter can't get enough oxygen.
Tiny little thing. The baby right after birth didn't cry real vigorously and did have a low heart rate, and so the baby was given some breaths to try to expand her lungs and to get her to breathe better. She had about 30 seconds of extra breaths to expand her lungs, and then she picked up her own breathing and picked up her heart rate and was then stable from that. Here you go, Mama. You want to hold her?
Yeah. You can touch her. You can touch her.
Got her?
Oh my God, her mouth like mine. Like she have a gap. When I had her, I was surprised because it was easy. It was easy, it didn't hurt. Just came on out there.
I'll be right back.
The premature infant is quickly taken to the NICU. The biggest threat is her undeveloped lungs. She is still not getting adequate oxygen.
Why don't we go ahead and put her on some nasal CPAP. She's not moving a whole lot of air either. Just go ahead and put her on. Start her on a CPAP of 6, please. Maybe her lungs are starting to collapse a little bit. And because of that, then we applied something called nasal CPAP. Those are little prongs that goes in the baby's nose, and they provide a pressure to help the baby overcome the work of breathing. So if her lungs are getting a little stiffer, they will expand the lungs and keep them open and prevent them from collapsing.
If she gets worse, they will be forced to put her on a breathing machine.
Well, I hope Miss Saunders' baby, over the next couple of hours, with the addition of the CPAP, will start to breathe easier, and that we won't have to progress on to putting a breathing tube in.
Doesn't mind that too much.
For any premature baby, the first 3 to 5 days are critical. For Erica's baby, the greatest challenge is just around the corner.
Can you bring this leg up, or is it pretty heavy?
It's 2 p.m.
Okay.
Just an hour earlier, it looked like Jana Barch was going to deliver quickly.
Your cervix is all the way thinned out, so that's good. It's completely effaced. And you're like maybe a good 5 centimeters. So this is taking a lot longer than I sure thought it would. Maybe we'll just kind of turn your Pitocin up just a teeny bit again, kind of give you a little oomph there.
Now it's turned into a waiting game.
I just checked her, and she's just making really slow progress.
They describe obstetrics as hours of boredom punctuated by minutes of sheer terror. That's where we are.
The increased dose of Pitocin will stimulate contractions. They know for the safety of this baby, delivery must come soon. For Alex Muchnick, carrying triplets has become more and more uncomfortable.
Much more tired. I can't breathe very well. It's like everything's pushing against my lungs.
She gained a pound of baby in the last week. We got anybody in there today?
Alex is now at 32 weeks.
That was the goal, make it to 32, make it to 32. Now we're making it to 32. Now they're saying, let's make it to 33, let's make it to 33.
Another sonogram shows that the omphalocele, the sac of organs growing outside baby B's abdomen, has grown too.
There's the omphalocele.
Dr. Matsumoto suspects that babies B and A are in the same amniotic sac. So anything that happens with baby B is a direct threat to baby A.
Baby B is obviously growing very slowly. That puts both A and B at risk. But nothing has changed, and that's why you're here.
They think Alex can hold out for week 33.
We're concerned about baby B, and I'm just afraid that perhaps baby B is just all of a sudden going to get sick, and with the 33 weeks, we should be able to have a good survival with baby B also.
Waiting another week means one more week worrying about the worst that could happen.
It was very difficult to hear that basically either way she's not going to make it. So it took a lot of days of getting used to that possibility. You couldn't give up hope on one because you'd be giving up on all of them.
Dr. Robertson has been telling us that there's a good chance that the one with the omphalocele is not going to make it, but there's always a chance that she will.
There's a lot of equipment in here.
Debbie Burris delivered her twins less than 16 hours ago.
Get over there.
This is her first chance to see them in the NICU.
Messing with your feet. This is the most exciting day. I'm just ecstatic, and their dad is too. He's been grinning all day.
Yeah, man, I tell you.
They look real good. I think they're well taken care of, and I hate to leave them, but I'll be back every day until they can go home. Yeah, it's kind of an emotional time, but you know, they look good. They really do look like they're well taken care of.
The premature twins are watched 24/7. Debbie can expect the twins will stay in the NICU until they reach her expected delivery date. That's another 6 to 8 weeks away.
It's too soon to tell right now to really gauge how well they're actually doing, but they're doing fine now, but the honeymoon period may end pretty soon.
While they look good now, changes can come fast. It's 4:30 in the afternoon.
Jana's about ready to deliver.
Jana Barcha's baby is expected to weigh more than normal.
Take a deep breath and blow it out.
Come on, Ferdinand, push.
3, 4.
Her large baby is at risk because the infant is in danger of getting stuck in the birth canal.
Good job.
Take a breath.
Let me see if you can do one more.
Crawl up into the launch of your chest and push. Push. Come on. Push, 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 push.
My biggest concerns about every patient is sudden, unexpected disaster. I mean, I always expect a problem, and then when it doesn't happen, I'm happy.
His head's out.
Head's out. Head's out.
Hang on. Just the head?
Uh-huh.
Just the head. Good God. Push.
3,
Come on.
4,
Push, push,
5,
push, push,
6,
push, push,
7.
push.
All right, good boy.
Good looking boy.
There you go.
How cute. Good job.
Come on, cover you over here.
Inducing delivery helped avoid the serious problem of shoulder dystocia. But how the baby was positioned did come as a surprise.
It turns out, you know, the baby was looking face up, which often is a problem, but because of the timing of the delivery, it didn't represent a problem so that she didn't have to have forceps. It's called sunny side up. Instead of coming down straight, he was a little bit cockeyed.
Hey, little guy.
But Jana was just great. Gracie, the nurse, did great. And so it all went very well.
Jana is relieved to have averted what could have been a disaster.
Look at that.
I've heard numerous stories about babies being what they call sunny side up, and that was a little frightening too. But everything worked out really good.
You did it.
Baby Chandler Barch weighs in at nearly 8 pounds. Erica is headed back to the NICU to visit her one-day-old baby.
She's a fighter, she's strong, she's little, and she's gonna need extra care, but she's doing good.
Gonna get it.
The premature infant will have to spend another 2 months in intensive care.
How does she feel?
Little.
She's a little over 24 hours, and she is doing great. And she started off on CPAP. This morning, we took that away, and she is just breathing room air now.
This is my first time holding her, and I'm comfortable. She feels little. She feels very little.
Have the energy to...
As Erica holds her, the baby's oxygen level suddenly drops.
If they put their little chin on their chest, it blocks off the airway, and they don't have the strength to move. So it actually brings down the oxygen level in her blood.
Oh.
So when you hold her,
Keep her
it's
head
good,
up.
yeah, to make sure that chin is up nice and high like that.
With that crisis over, Erica looks forward to spending time with her baby.
Wake up. It felt great to hold her for the first time. She's so little, but I enjoy it.
But while her baby girl must stay in the hospital, Erica will go home tomorrow.
And I will be here every day, all day.
Comes another contraction.
Misty Ferguson's labor had apparently stalled. Now she has suddenly made surprising progress.
So she's gone 6 centimeters in 2.5 hours.
I'm about to be a father. Got another hour to wait, and then we're gonna start pushing.
You're almost through. You just gotta wake up.
The magnesium Misty was given to stave off dangerous seizures has had a side effect. It makes her sleepy.
Misty, wake up. Want her to wake up. This is cool. Well, y'all saw her a couple hours ago. She was hurting, and I've never seen anybody sleep through the contractions she's having, and just, this is cool.
The head is there. We're gonna have a baby in the next half hour. Okay, I'm gonna sit and then look at you. Misty, can you believe how fast your labor progressed in the last few hours?
I've been asleep, so I've...
At least you've been comfortable, right?
Misty's 9 hours of labor are about to end.
Dad, you gonna cut the cord?
I don't think so.
Okay, let's pull your legs back and let's have a baby.
Come on, Misty, push real hard.
Pushing now.
Keep pushing.
Push,
There you go.
push hard, push hard. Keep going, keep going. Real good.
Harder,
Keep
harder,
going,
harder,
keep
harder.
going. Push,
Harder, you
push.
can have a baby. Harder, harder, harder. You got a cute little boy.
1551.
Okay, Dad, your turn.
With Dr. Milstein's urging, Kelly goes through the father's rite of passage and cuts his baby boy's umbilical cord.
Good. There you go. Congratulations. Sounds good. May be a little bit small for dates because of the blood pressure, but for the most part, everything looks great.
Caleb Ferguson is checked out by the nursery staff.
Misty was at high risk of developing further problems if we allowed her pregnancy to continue. If we had not delivered the baby and allowed the pregnancy to continue, the blood pressure problems would have worsened.
I gotta get a picture. He's holding it. I gotta get a picture of Kelly.
Misty is not yet out of danger. She will stay on magnesium sulfate for 24 hours and will be closely monitored for seizures. The Burris twins have been in the NICU for 2 days.
She's doing much better.
Both are on IV nutrition. And John's lungs still need help.
He's in an open warmer because he's not doing as well as his sister. She's doing much better, so she is in an isolate.
The staff keeps a close eye on baby John. He still suffers moments when he needs encouragement to breathe.
So we just kind of remind him gently by rubbing his back that he needs to take a deep breath.
The twins' development follows a pattern their doctor has seen before.
At the embarrassment of being a male, but girls always do better than what boys do when they're born prematurely. They always do. And that's just natural. We don't always understand exactly why. I'm sure females would say that it's always they're the stronger sex, but I won't get into that and we won't go there. But girls tend to always do a lot better than what boys do.
Hopefully in a day or two, we'll be able to take his oxygen off and he'll go into an isolate also, possibly into the same isolate with his sister.
I'm going home. Discharged, released, out of here. Ready to go.
But Erica's premature daughter, Manaya, will have to stay.
Yeah, it makes me sad to live without her, but I'm gonna be here and I know she'll be all right. She needs to get better, so she can go home and be all right.
Did you pick out a name yet?
Yeah, her name is Manaya.
Oh, that's pretty.
Oh, I bet she want her booties on.
Manaya is jaundiced. The blue light is a photo treatment that helps remove the bilirubin toxins from her blood until her liver begins to function.
I'll be back.
We'll take good care of her.
Okay.
After 18 days in Medical City Center Hospital, Erica goes home.
We hardly ever have moms come in by themselves or deliver by themselves, much less go home by themselves too. It's not common at all. Nobody was here the whole time she was here. I don't know, it's kind of sad.
But for Erica, the sadness comes from leaving baby Manaya in the NICU.
Yeah, it was hard to say goodbye, but I know I'm coming right back. So it's okay.
Alex Muchnick is being prepped for a C-section to deliver her triplets.
You guys excited? Oh, sorry.
Alex was supposed to deliver next week, but her condition changed rapidly overnight.
She went into labor this morning, and that's something that's uncontrollable. One could try to stop the labor, but with triplets at 32 weeks, the best thing is to just let them come out. Did you test her?
Yes.
Okay. Good.
The triplets, all girls, are coming 2 months early, and one has a life-threatening condition.
Now just hold that right there. Meds, please. Oh, I think it might just get...
The triplets are coming 2 months early, and one has an omphalocele, a life-threatening condition.
Take this out. Thanks. Okay, here comes the first baby. The suction.
Baby A is delivered first.
All right.
Baby B, the infant with the omphalocele, a sac of organs outside its abdomen, is next.
Got that?
Just a flood of emotions. I did start to cry. We do have one of the babies that has an omphalocele.
Okay.
Didn't want my wife to think that I was crying for any other reason, so I kind of had to just bite my lip and push that kind of aside.
Finally, baby C is delivered.
Hey!
Wow. See here?
Got it.
Okay.
For blood? Yes.
Right now, the most important thing is to keep them breathing and warm. All 3 babies are quickly moved to the NICU. Baby A, Frances, is 3 pounds 5 ounces. She needs help breathing. Baby C, Catalina, is the largest of the triplets, just under 5 pounds. Baby B, Natalia, is the smallest, just 2 pounds 12 ounces.
The doctors put in an ET tube just to help her breathe. We have her on the ventilator to breathe for her.
Natalia needs the most attention. Finally, doctors can examine the omphalocele. It is larger than anyone had imagined.
The early expectation was that it would not be that large. You never can get an accurate assessment of that until you can actually look at the baby after birth.
Let me... Dr. Olney, do you want a CBG on her? Okay.
The outcome is far from certain. Baby Caleb is ready to go home, and his mother's blood pressure is back to normal.
My blood pressure was 142/63 this morning. Go ahead, Dad.
That's the lowest it's been since I've been here. So that's really good.
Now, 2 days after delivering baby Caleb, it's time to go home.
All right.
I feel wonderful to be a father for the first time. I'm excited. I'm ready to get to the house. Been in the hospital for 6 days. It's been long. It's been a long week. Long, long week.
Debbie Burris and her husband John are ready to go home too, but their twin babies will remain in the NICU.
I'll be right back. We'll have to say goodbye. I'm trying not to cry about that, but I think he likes this. I just have to come up here every day.
Now, just 4 days old, the babies will be in the NICU for weeks to come. But they're doing better each day. The twins are eating more and gaining weight.
Hi.
Just 2 hours after surgery, Alex Muchnick is visiting her triplets for the first time.
She's doing great.
Can you go check?
Yeah, sure.
We knew what we were to expect, so we're not shocked. We've had some pictures and everything. And she looks good to me. She still looks beautiful to me.
Seeing baby Natalia in the NICU drives home the seriousness of her condition.
I had seen many pictures of babies with infolocele, so that part wasn't shocking. It was just the fact of seeing my baby with an infolocele. I know that really she's not in any pain with the infolocele, but I kind of felt some pain.
Look at those cheeks.
In their first day of life, all 3 babies are getting help breathing. While all 3 girls have a long road ahead, Alex and Philip are most concerned for Natalia.
We were concerned about her just surviving the pregnancy, and she survived that, and she survived the birth, so we're still very optimistic. You gotta keep hope.
Jana and Derek Barch are eager to get baby Chandler home.
Day 2, and he has no problem eating. We have a little bit of problem staying awake, but once he gets out of that, then Mommy will be in trouble.
You made parole. For all the problems that we could have had, everything went about as smooth as it possibly could have been. We're real happy about that.
We're going home. Oh, yeah. Well, we might have.
Excited to be going home. Glad that everything went pretty good, and ready to get Chandler home.
Went very good.
Spend some time with his sister. And I'm sure she wants to rest.
That'd be nice.
Just hours after being discharged from Medical City Center, Erica Sanders is back at her baby's side. And for as long as necessary, she plans to visit around the clock.